I'm Mackenzie, and this is Dr. Scott Christie, and welcome to another episode of Cheer District's Injury Prevention Series. So this episode, we're going to talk about Sever's disease. Dr. Scott, can you tell us a little bit more about what exactly that is?
Yeah, definitely. When you take a look at Sever's disease, it's actually an injury in the heel, and mostly you're gonna see this in a younger population, but it can go all the way up into like the age of 14 because it has to do with growth plates. And so on the heel, and if you take a look at a picture, on the heel there'll be a little piece of bone that sticks on the back side of the heel. In between that little piece of bone and your main heel bone, there's a space in there, and that's called your growth plate. But your actual, where your calves come down and turn into to attach onto the heel, it attaches onto that little piece of bone that's not completely attached to the heel. So I know it can get a little bit confusing, but basically if you think of your heel, there's two little bones there, one little sliver of bone, and then there's your main heel bone, and there's a growth plate in between there. That little growth plate is typically what we would say is Sever's disease when it gets inflamed. And so we're trying not to confuse this with other things like injuring your tendon or your Achilles tendon as it attaches onto there, or the arch of your foot. The Sever's disease actually just has to do with the growth plate.
So as an athlete, how does this feel? How does this disease affect an athlete?
What you'll notice usually when the athletes wake up in the morning, they'll have a hard time, like it'll hurt. It'll hurt to walk. They may see some redness on the heel. That would be another sign. Maybe it's not quite as bad, so it doesn't start to hurt until you're actually jumping. Okay, those are typically the big three, or actually one more, walking on the ball of your foot. All of those, you will feel pain like around the actual heel. And that's basically what you're looking for as an athlete.
So if I was a coach, what would I be looking for in my athletes?
So what you would be looking for is if the athletes are limping, or they're maybe not jumping as high as they should. And the reason, I know it doesn't seem like a coach's responsibility, but the reason you would be looking at this is because you want to make sure that it is only the Sever's disease. And I know Sever's disease sounds like a horrible name, but it's not a very serious injury compared to if the athlete was dealing with an Achilles injury where the tendon was actually starting to tear a little bit. In that case, you'd want to make sure you're definitely sitting the athlete, pulling them out and get them checked. With the Sever's disease, you just want to make sure that they're describing the pain as being on the heel, and if it is, then you guys can kind of look at modifying a few things, but they still should be able to keep doing things. I just think it's important that you guys are aware that one is a little bit more serious than the other.
Okay, and how long would Sever's disease last?
That's a good question. I'm going to kind of give you two answers. Okay. Based on how sore it is at the beginning and based on each individual athlete, it can vary. But generally, you're looking at 2 to 3 months is kind of the normal, and it'll go away. But the reason that this is a tricky answer is it can come back. And the reason it can come back is you still have the growth plate open and active until you're about 14 years old. So let's say you have the heel pain when you're 11, it goes away. Well, you still have an active growth plate there, so it could get re-injured. So the idea is, a couple months. Sometimes, like I've treated athletes where it's gone away with a good taping job and some rehab in like 2 or 3 visits. So it's kind of all over the place, but on average a couple months, and it's really not something to be too concerned about. It just hurts quite a bit.
So say an athlete went to a therapist and it was determined that they did have Sever's disease. Can the athlete still practice?
So first I think we're going to say like that's going to be determined by the actual therapist as to whether or not they want that athlete to continue. So that aside, I'm just going to give you kind of how I would deal with this. Yes, they can continue to cheer as long as it's not interfering with things that might be a little bit more dangerous. So let's say you're dealing with an athlete that needs to do a standing back tuck, but they're having trouble getting that done on a normal basis. If they're sore, they're not going to jump as high. So in cases like that, you may need to take some things out. You can try taping up the heel. A lot of times that will take the pain away. So yes, you can continue to cheer, but if you're noticing that it's getting worse, then you may have to take a different strategy at that point and not try to work through it.
So knowing all of this, is there any way we can prevent Sever's disease?
think knowing what causes Sever's disease. So I think we didn't really talk a lot about this, but Sever's disease usually occurs during growth spurts. And so if you can just work on increasing your strength and your flexibility and your balance and your power like we did in episode 1, that will be a major determinant on trying to make sure that this doesn't occur. The other side of this is Sever's disease can occur when you start to do too much. So meaning, when it becomes competition time, you start to practice a little bit more and a little bit more volume, but some athletes still will be doing things on the side, like doing private lessons for tumbling. So as competition's near, you may need to take some of those things out so that you're not doing so much volume as your practice volume or your practice intensity increases. You may want to remove some things out of your schedule as you're leading up to that. And those two things combined should help reduce the chances of getting Sever's disease.
On the next episode, we'll be talking about how to prevent injury to the hips and the knees. See you then.